And we are live. It's Dr. J here in the house. How y'all doing? Happy Friday. Looking forward to digging into a bunch of questions. Hope everyone is doing great. So let's chat. To clean my teeth, I use bicarbonate of baking soda and coconut oil every day. And now again, I brush with active carbon, but it doesn't last long. That's good. That's helpful. Baking soda is great. You can do baking soda with hydrogen peroxide. You can do like a 4-part hydrogen peroxide, 1 part baking soda, and that is excellent for cleaning the teeth. Great natural whitener. And then, of course, the coconut oil is great for like oil pulling on that side of the fence. So that's actually really good. All right, we'll keep on rolling here, y'all. How do I boost glutathione? Organic acid test shows I'm low on it, and what are the causes to why I'm low? So low organic acids for glutathione typically mean like imbalances in sulfate and pyroglutamate. These are the organic acids that correlate for glutathione precursors. So, of course, just getting good quality protein, making sure your digestion's good, making sure you're eating good protein sources, animal products, good cruciferous vegetables, making sure you're digesting and breaking them down. That's number one. And then number two, making sure there's not a toxic load that you're being exposed to that would cause you to burn through a lot more of the glutathione at higher levels. Those are the big things you can do. Riley writes in, what's your heavy metal clear protocol? 3 capsules twice a day on empty stomach. Long to follow protocol. Yeah, so you just take the heavy metal clear, 2 to 3 caps before food is totally fine. There's a whole bunch of good binders, pectosol, pectins, chlorella, glutathione precursors, really helpful. Gabe writes in, I'm on your parasite cleanse 145. I'm in my fifth week in. I did not get any Herx reactions. What previous patients? Is there any indication in the cleanse? I'm feeling a bit better in one symptom. That's good. I mean, if you're not having any Herxheimer's reactions, Herxheimer reactions, just for the listeners that may not know, are just negative symptoms. It could be gas, it could be mood, it could be brain fog, it could be fatigue, it could be achy joints, kind of flu-like symptoms. If you're not having those symptoms, that means your body's dealing with the dead debris and the biotoxins that are spilling out from the killing. Your body's able to handle it, which is a really good sign. So I like that. I just found out, Yoli writes in, I just found out about adrenal fatigue, and I would like to know if my feelings of being weak, exhausted, anxious, and sometimes feeling a panic attack I have to do with the adrenals. Yeah, it's very possible that it has to do with the adrenals. You have to get tested. There could also be some thyroid and or mitochondrial things connected with that. Barbara writes in, evidently, but I don't see Dr. J. I know I'm here. Let's see here. Yeah, patients run late, so I'm running late. Massimo writes in, with cellulates and hemocellulase in digestive enzymes increase the glycemic index of food due to the breakdown of the fiber? Great question. Not sure. Not really sure about that. I would get your blood sugar meter out and do a before and after and see if it makes a difference. I'd imagine it probably wouldn't if we're talking whole foods. Probably not a big deal. Genesis writes in, how to balance 2-hydroxy and 16-hydroxy estrogen metabolites. As a 28-year-old male, when eating plenty of cruciferous vegetables doesn't help, and red splotches are appearing and growing on skin. So first off, I'd measure your estrogen levels. I do a Dutch complete panel and look at your adrenals and or just your sex hormones, see how you're metabolizing your estrogens as well. Make sure your metabolism is good. And I would throw in some specific sulfur amino acids, and I'd also throw in diindol methane, a couple hundred milligrams a day, along with the sulfur aminos. And I'd even throw in some fiber as well to help bind up some of the toxins. And I would see how that goes. So I forget it's 2, 4, and 16 hydroxy estrogens. And I think you want more of the 2 and less of the 4 and the 16, if memory serves me right. And the red splotches are the little cherry hemangiomas that happen from estrogen dominance. So basically avoid the hormones and the junk in the food and the meats. Make sure your insulin's under control so you're not aromatizing your testosterone downstream because of too much insulin. Make sure you're doing healthy meats. And make sure you're doing healthy cruciferous vegetables and add in the fiber and the diindol methane along with the sulfur aminos. And that should be very helpful for you. Awesome. Let's see here. Neil writes in, I'm taking vitamin C daily, but it's raising my iron levels. Any way to reduce them other than giving blood? I wouldn't worry about your iron going up. Just give blood. That's going to happen naturally. I have to give blood really soon. It has been a while for me. I got to go do it soon. My wife is having recurrent yeast infections. What can we do about this? Make sure she's not feeding it with sugar or refined carbohydrate in her diet. That's number one. And then number two, she may need a really good clearing cleanse with some oil of oregano and some silver and some other herbs to help knock it down. But don't feed it, then starve it. And then we can always use some good probiotics to knock it out too. The question is, what happened? Was there some antibiotic use that happened recently? What's going on there? Excess carbohydrates? What do you think? Excellent. It's Dr. James writes in, not Jay, it's Tom Brady's season. What does your Tabata workout look like? Any particular exercises? I keep it really simple. I just do it on a rower, partly because people don't get a lot of extension in their back. So I do the rower because I'm getting a lot of extension in my back. So that's how I do my Tabata. I do it on a rower. Hope that helps, James. Lana writes in, is it okay to take Vastic gum with probiotics? I typically would do a lot of the herbs, the clearing herbs with probiotics. If it's a second round that we're doing, I would do a second round with probiotics. Mastic gum's pretty good though. If you wanted to do it with probiotics, I'd have no problem with that at all. What to do if you get food poisoning? I had diarrhea, it's gone, but still feel dizzy. So first off, if you have food poisoning, one of the first things I would do is oil of oregano. High doses of that can be super helpful. That's in my GI Clear 5 line. If you have probiotics like a lactobacillus bifidobacter blend, you can always do that 1 to 2 capsules every hour or two. And then you can always throw in some activated charcoal to bind up some of the dead debris. If you do that, you're going to be pretty darn good and get out of Dodge pretty fast with that food poisoning. Flea Bob writes in, is it worthwhile to get a Lyme test if it's suspected and if I'm already in a chronic stage? So you have to give me a little more elaboration. Like, do you mean you already saw a bullseye rash? What makes you think it's already suspected? Are you just basing it off of the Lyme symptoms of fatigue and joint pain or something else? Let me know. Lana writes in, would your clearing herbs for SIBO still work if one is not following a strict low FODMAP diet and is often bloated? Well, when you're doing the FODMAP, when you're doing the killing or the clearing phase with the herbs, we actually want to be eating more carbohydrates and more FODMAPs to tolerance. The FODMAPs act like cheese on a mousetrap and bait some of the critters out, and it can be helpful to allow the herbs to do better. So we only, low FODMAPs great leading up to that, but then we'll add some of these fermentable carbohydrates, cruciferous things back in, onions, garlic, and they'll kind of act like cheese on that mousetrap to lure out the bacteria. Hope that helps. Does oat show, oh, where'd it go? Does oat show intolerance to dairy and casein? No, it does not. What's the best time of day to take probio and sacroflora? I like morning and night, but in between meals during the day would also be acceptable. But morning and night, when you get up and when you go to bed, tend to be pretty safe as well. Rebecca writes in, even after having my heart, blood, and GI checked, I still have massive pain, rigidity, and twitching in my neck, muscle and trap and other muscles. I do mag, vitamin C, but not. What could it be? I need a little bit more information about what's going on. But of course, there could be some adrenal issues. There could be some gut issues there too. I would need a lot more info about what's going on. But off the bat, get your gut and get your adrenals looked at for sure. Jeff writes in, the doctor said my left testicle has an infection, chronic epididymitis, now on antibiotics, sick and nauseous, need help. So yeah, I would be on some probiotics right now here, Jeff, even while you're doing the antibiotics. I know we talked about that epididymitis infection a while back, but let's make sure it's cleared up. I mean, I think you should be doing the antibiotics with an infection like that. You just don't want to mess around, but we should come in with some really good probiotics on the flip side to work on that. Okay, good to hear. Alana writes in, if you have low stomach acid, should you take HCl even if it's a veggie meal with protein powder? Probably not. I would just stick to enzymes with that. Maybe if you want to do a little bit of apple cider vinegar, fine, but I wouldn't do much HCl from a supplemental standpoint. Dr. Dreamer writes in, hey, Dr. J, how long after stopping an SSRI can you start with aminos, 5-HTP, tryptophan? Any ideas on dosages? So what I typically do is if someone's on an SSRI, I typically stabilize them with the aminos first because that actually makes the SSRI work better. And then once I'm stable, then I drop the SSRI from there. So amino acids first, then get stable, and then drop the SSRI second, and make sure you're under the guidance of the prescribing doctor. If you've been on SSRI a long time, you may take you months, maybe even a year to come off if you've been on it longer than a decade. So you got to be really, really careful there. Okay, excellent. Let me see here, y'all. Let's see. Michelle writes in, I'm very deficient in zinc. Well, do the zinc tally test. It's the zinc chloride. I think it's the liquid zinc. The better it tastes, the more zinc you need, the more metallic it tastes, the less zinc you need. So that's a pretty good indirect test that you can use to assess your zinc levels. And animal products are going to be good. Seafoods are going to be good. Pumpkin seeds are going to be good. Tea Time writes in, my LDL rose 96 points in 3 months. Since starting keto, I'm thin. I haven't lost any weight. Wonder if I should just go low carb and less saturated fat. I would need to know your full levels. I mean, if your LDL, I mean, I need to know what's your total cholesterol, what's your LDL, what's your HDL, what are your trigs, because you got to look at the whole thing. Just because your LDL rose 96 points, that may be a good thing. Cholesterol less than 140 can increase chance of depression, mood issues, and cancer. So having low cholesterol also isn't ideal either. Flea Bob writes in, suspected Lyme, no rash due to lingering chronic fatigue. So here's the deal. Lyme's one of these things that it's like there's three major rat holes of functional medicine. The mold mycotoxin rat hole, the Lyme rat hole, and the MTHFR rat hole. Why do I call it a rat hole? Because it's such a massive umbrella of symptoms that anyone that thinks they have fatigue or mood issues or digestive issues or cognitive stuff, they all could potentially fit into that basket, when there's a lot other low-hanging fruit that should be looked at first, like your adrenals, like your gut, like your digestion, like your diet. So I always kind of go through the hierarchy and work through the low-hanging fruit before I go down the rat holes of functional medicine, which are those things. So go to the other things first that I mentioned and then deal with that stuff later. Michelle writes in, having a hard time raising zinc, chronic gut infections, any suggestions? Yeah, get your gut tested and make sure your diet's clean, and then make sure you are optimizing hydrochloric acid and the enzymes in the process. Holly writes in, my husband has hidradenitis suppurativa. I've read a lot about it. Many people with it have this condition, having a yeast sensitivity. What's the best way to find out if you're yeast sensitive? I've seen probably a dozen patients with hidradenitis suppurativa. It's an autoimmune condition. It's difficult, right? Because like these big boils kind of settle and they can be really painful and tender. But you have to go on an autoimmune template and you have to go and work to the 6 R's. You're going to need a functional medicine kind of practitioner to work with your husband on this to get to the root cause. It can be tricky. Genesis writes in, massive chest pain left side when trying to exercise. I was 22, 28 now. How to improve angina symptoms if exercise is difficult, and if you already eat a perfect high-fat, clean paleo diet. Well, I mean, I would need some testing to figure out what's going on. I'd want to make sure magnesium's good from an intake perspective, so at least a gram a day. I'd want to make sure potassium's good, at least, in the mid, 4.5 grams a day or so on the potassium. I'd want to make sure your diet's really clean. I want to make sure you're digesting your food well. I want to make sure your adrenals look good. And then, after that, I'd want to look at your mitochondria, make sure you have enough CoQ10 and carnitine and all these good nutrients to allow your heart to beat optimally. So I'd want to look deeper there. Carolina writes in, I've been diagnosed with endometriosis a few weeks ago. What could I do to control it in a natural way? The doctor gave me the progesterone pill. So off the bat, endometriosis is basically where you have endometrial tissue growth outside of the uterus. Like it'll start growing on the outside of the uterus or on the ovaries or even on the abdominal, the outside of the intestines. It's primarily going to be driven through an estrogen dominant type of environment. So first thing I like to do is make sure the diet's clean. Paleo template, lower carb is going to be great. Anti-inflammatory, cut out the grains. After that, do some hormone testing. Really got to support the estrogen dominance. Get the progesterone and estrogen ratio back in order. And sometimes we'll use bioidentical hormones to support that. And other things that we may do some supplemental iodine and even systemic based enzymes to help support that and to break the endometrial tissue down. But it's tough because they'll just kind of gauge its endometriosis by the pain, and they may need to do some kind of a laparoscopic procedure to go look at it to visualize it to know for sure. But you want to get to the root cause. Rebecca writes in, what blood test for checking the adrenals and TSH? Well, I mean, there's an ACTH stim test for looking at like Cushing's or Addison's disease. Basically, they give you a stimulant and then the cortisol should go up. If it doesn't go up, then that's kind of Addison's. If it's up too high on a cortisol serum, that's Cushing's, right? Push. Cushing's is high cortisol, Addison's is low cortisol. Addison's is what JFK had. So in general, those tests aren't going to be super helpful unless it's a pathological condition. So you really want to do a salivary or a urinary cortisol test. And TSH is going to be a simple blood test, but that won't tell you enough either. Got to do a full thyroid panel, TSH, T4 free, T3 free. You could even run the T4 total, T3 total. You could run reverse T3 and then thyroid antibodies. T-Time writes in LDL 196, total cholesterol 306, HDL 95, trig 62. So your HDL to trig ratio is actually pretty good. And your total cholesterol, the HDL ratio is not bad either. So if you do 306 divided by 96, you're at 3.18. So once you go below 3.5, you're half the average risk factor. So if you look at the ratios though, T-Time, I would say your levels aren't that bad. You're still at half the average risk factor because your HDLs are so good and your HDL to trig ratio is good. So I really wouldn't be too worried. Your total cholesterol is a bit high. So is there any hypercholesterolemia? We could always do some higher dose berberines to knock it down if you wanted to a little bit, but I wouldn't worry a ton. Maybe look at the thyroid and make sure the thyroid isn't low and make sure there's no excess inflammation in your body or your gut. Jeff writes in, that helps exactly. Doctor put me on hydrocodone and acetaminophen, and the blood tested me and showed elevated liver enzymes, raised like almost not detoxing. Well, I mean, if the enzymes are raising, I would go on some glutathione, acetaminophen. I think that's Tylenol, right? That's notorious for lowering glutathione. So I would also go on some glutathione. I go on some probiotics. And I know you have some back pain, so I would try to use as much of like liposomal curcumin. I would also do some topical CBD oil, rub it right on the back. And I would do some Boswellia, and I would try to get off with the guidance of your prescribing doctor off the opiates. Super addicting stuff. What do you recommend for someone recently diagnosed with Hashimoto's? Get the adrenals looked at. Make sure you know where your thyroid's at. Are your hormone levels with your thyroid low? Is your TSH elevated? There's so many patterns that could be present. When I was first diagnosed with Hashimoto's, my thyroid still looked great. So some people, their thyroid looks great. They have Hashimoto's. Some people, their thyroid looks terrible when they have Hashimoto's. Some have adrenal issues and thyroid issues. You really have to look at the whole picture to know where the next step is. But of course, paleo template is going to be, paleo template, autoimmune template to start, and then work there, and then work with a functional medicine practitioner to get properly assessed. All right, y'all. Hope everything is going great. I got a patient in a half hour. I'm going to go grab some lunch. Hope you guys have a phenomenal Friday, and I'll be back here on Monday. Take care, y'all. Bye.